Bowel cancer is the second leading cause of death in women and the third leading cause of death in men. As you probably know, large bowel cancer is the third most common type of cancer worldwide, accounting for 10% of all cancer cases. But how is large bowel cancer diagnosed? What is the treatment for large bowel cancer? Does large bowel cancer and rectal cancer have early symptoms that we can identify to recognize this dangerous disease as quickly as possible? This type of cancer is considered one of the diseases where the risk of death decreases if diagnosed early. That's why it's important to prevent it by recognizing the symptoms of large bowel cancer and preventing the progression of the disease. Colon cancer, also known as colorectal cancer, is a type of cancer that occurs in the large intestine. The large intestine is the end part of the digestive system. Sometimes colon cancer is also referred to as colorectal cancer, which begins in the right side of the intestine. Colorectal is a term derived from the combination of the words colon and rectum. Colon cancer usually begins with the formation of small benign growths called polyps in the inner lining of the large intestine. Initially, polyps are small, few, and symptomless. That's why regular monitoring and screening are necessary to control and remove polyps before they become cancerous. Causes of bowel cancer. The development of bowel cancer typically involves a combination of genetic, environmental, and lifestyle factors. While age, family history, and certain genetic mutations predispose individuals to colorectal cancer, modifiable risk factors such as diet significantly influence disease onset and progression. Chronic inflammation of the bowel, often exacerbated by dietary choices, can contribute to the development of colorectal tumors over time. Recognizing the symptoms associated with bowel cancer is essential for timely diagnosis and intervention. Here we delve into the various bowel cancer symptoms, shedding light on their significance and implications for health. Number 1. Changes in bowel habits. Changes in bowel habits are among the hallmark symptoms of bowel cancer. Individuals may experience persistent diarrhea, constipation, or alterations in stool consistency. While occasional changes in bowel habits are normal, prolonged disruptions should raise concern. It's essential to pay attention to any unusual patterns in bowel movements, particularly if they persist for more than a few days without apparent cause. 2. Rectal bleeding. The presence of blood in the stool or bleeding from the rectum is a red flag for colorectal cancer. This symptom often manifests as bright red blood in the stool or as dark, tarry stools. While rectal bleeding can stem from various gastrointestinal issues, including hemorrhoids or fissures, it should not be ignored, especially if it recurs or accompanies other symptoms. 3. Persistent abdominal discomfort. Persistent abdominal discomfort, such as cramping, gas, pain, or bloating, can indicate underlying gastrointestinal issues including bowel cancer. While occasional digestive discomfort is common, persistent or unexplained abdominal symptoms warrant medical evaluation. Such discomfort may be localized or diffuse and may worsen over time, signaling the need for further investigation. 4. Weakness or fatigue. Unexplained weakness or fatigue is a nonspecific symptom that can accompany various medical conditions, including cancer. In the context of bowel cancer, persistent fatigue may result from anemia secondary to chronic bleeding. Anemia, characterized by a low red blood cell count, can cause fatigue, weakness, and shortness of breath, necessitating medical assessment to uncover its underlying cause. 5. Unexplained weight loss. Unintentional weight loss without dietary changes or increased physical activity can be an early warning sign of colorectal cancer. While weight fluctuations are common, significant and unexplained weight loss should prompt further investigation. Cancer-related weight loss may result from metabolic changes, decreased appetite, or tumor-induced alterations in nutrient absorption. 6. Feeling of incomplete bowel emptying. A persistent sensation of incomplete bowel emptying, even after a bowel movement, can be indicative of colorectal cancer. This symptom may manifest as a feeling of fullness or pressure in the rectum or lower abdomen. It often accompanies other bowel symptoms and warrants prompt medical attention for thorough evaluation. 7. Anemia. Anemia, characterized by a deficiency of red blood cells or hemoglobin in the blood, can result from chronic bleeding associated with bowel cancer. Symptoms of anemia may include fatigue, weakness, pallor, dizziness, or shortness of breath. While anemia can arise from various causes, its presence in conjunction with other bowel symptoms should prompt investigation for underlying colorectal pathology. 8. Nausea or vomiting. Although less common, nausea or vomiting may occur in individuals with advanced bowel cancer, particularly if a tumor obstructs the bowel or interferes with gastrointestinal motility. Persistent or unexplained nausea and vomiting should be evaluated by a healthcare professional to identify potential underlying causes, including colorectal cancer. Foods that may adversely affect bowel cancer risk. Certain dietary factors have been linked to an increased risk of bowel cancer. These include processed and red meats. Consumption of processed meats such as bacon, sausage, and deli meats, as well as red meats like beef, pork, and lamb, has been associated with a higher risk of colorectal cancer. The high levels of saturated fats and heme iron found in these meats may promote inflammation and contribute to carcinogenesis in the colon and rectum. High-fat foods. Diets high in saturated fats, trans fats, and cholesterol, commonly found in fried foods, processed snacks, and baked goods, have been implicated in colorectal cancer development. These fats can promote inflammation and oxidative stress in the gut, fostering an environment conducive to tumor growth. Refined carbohydrates and sugary foods. Consumption of refined carbohydrates, including white bread, sugary cereals, and pastries, has been associated with an increased risk of bowel cancer. High intake of sugary foods and beverages can lead to insulin resistance and elevated blood sugar levels, which may fuel tumor growth in the colon and rectum. Alcohol. Excessive alcohol consumption has been linked to colorectal cancer, with heavy drinkers facing a higher risk of developing the disease. Alcohol can disrupt gut microbiota balance, impair immune function, and promote inflammation, all of which contribute to colorectal carcinogenesis. Foods that may support colorectal health. A diet rich in fiber, antioxidants, and healthy fats can help support colorectal health and reduce the risk of bowel cancer. Incorporating the following foods into your diet may be beneficial. Fruits and vegetables. Colorful fruits and vegetables are rich in fiber, vitamins, minerals, and phytochemicals that possess antioxidant and anti-inflammatory properties. Aim to include a variety of fruits and vegetables in your diet, such as leafy greens, berries, citrus fruits, cruciferous vegetables, and tomatoes. Whole grains. Whole grains such as oats, brown rice, quinoa, and whole wheat are excellent sources of fiber and essential nutrients. Fiber helps promote bowel regularity, aids in waste removal, and may reduce the risk of colorectal cancer by preventing constipation and maintaining a healthy gut environment. Legumes and beans. Legumes, including beans, lentils, chickpeas, and peas, are rich in fiber, protein, and various micronutrients. Incorporating legumes into your meals can help increase fiber intake, promote satiety, and support digestive health. Healthy fats. Choose sources of healthy fats, such as avocados, nuts, seeds, and fatty fish like salmon and mackerel. Omega-3 fatty acids found in these foods possess anti-inflammatory properties and may help reduce the risk of colorectal cancer by modulating immune function and inhibiting tumor growth. Probiotic foods. Probiotic-rich foods, such as yogurt, kefir, sauerkraut, and kimchi, contain beneficial bacteria that support gut health and immune function. Consuming probiotics may help maintain a diverse and balanced gut microbiota, which is essential for colorectal health. To treat bowel cancer effectively, a combination of medical interventions tailored to the individual's condition is typically employed. 1. Surgery. Removes the tumor and nearby lymph nodes. 2. Chemotherapy. Kills cancer cells or prevents their growth. Administered before or after surgery, or as the primary treatment for advanced cases. 3. Radiation therapy. Targets and destroys cancer cells, often used in conjunction with surgery or chemotherapy for rectal cancer. 4. Targeted therapy. Targets specific abnormalities in cancer cells, inhibiting their growth and spread, used alone or with other treatments such as cetuximab or bevacizumab. 5. Immunotherapy. Stimulates the body's immune system to recognize and attack cancer cells. While still under investigation for bowel cancer, drugs like pembrolizumab may be used in certain cases. Supportive care measures, including pain management and psychosocial support, are also vital. Early detection through regular screening and collaboration with a multidisciplinary healthcare team improve treatment outcomes and overall prognosis for bowel cancer patients. Thanks for tuning in. We've put in hours of research to bring you quality content. If you liked what you saw, hit subscribe and the notification bell for more. Your support means the world to us. Remember to like, comment, and subscribe for future videos. See you next time.